This is Nursing Australia, proudly brought to you by APNA, the Australian Primary Healthcare Nurses Association.
Welcome to Nursing Australia. I'm Karen Cook, and I'm really excited to be your host for this episode. I've been a nurse now since 1979. That's a lifetime. Indeed, I started nursing before many of you listening to this podcast were even born. But doesn't that say a lot about what a great profession it is? That you choose to spend your entire working life as a nurse. I think that's something that we really should celebrate, all of us. In this episode today, we're looking into the COVID vaccines that are currently in development, and we're forecasting when they may be readily available in Australia.
There's a whole series of different vaccines in the pipeline. So there's more than 200, in fact, that are in preclinical and clinical studies.
We take a positive look at aged care and explore not so much what has gone wrong in the sector during the pandemic, but what has gone right.
I feel like that improved relationship actually impacts so positively on the resident because they can see that unity with their loved ones, like they can see you're all working together.
Then we're going to dive into the data and hear the trends that have emerged in APNA's PulseCheck surveys and hear how APNA is using this information to advocate for primary healthcare nurses.
These long-term employees really dedicated to their role were just cut. And a lot of nurses who called our helpline said they weren't going to do primary care anymore.
And finally, we take it down a gear with our nurse wellness section. We take some time out for you to relax and reconnect. But first, here's the news.
In this bulletin, the federal government extends telehealth for practice nurses. APNA supports nurse prescribing for early medical abortions. A new nurse-led clinic opens in Canberra, and COVID-19's deadly toll on nurses around the world.
This is Nursing Australia News.
Hello, I'm Tony Wells. APNA has welcomed the federal government's extension of Medicare-subsidised telehealth until the end of March 2021. An additional $2 billion in funding will ensure practice nurses, GPs and allied health professionals can continue using telehealth to support patients during COVID-19. APNA President Karen Booth says that while the announcement is a great way to cap off Nursing in the Community Week, telehealth should become a permanent part of primary healthcare in Australia. Nurses in particular have embraced telehealth for patients with chronic disease, and it's also been incredibly valuable in providing healthcare to rural and remote Aboriginal and Torres Strait Islander communities. Health Minister Greg Hunt says the scheme has been a revolution in health with more than 30 million consultations so far.
It's kept the patients safe, it's kept the nurses safe, it's kept the doctors safe.
That audio from ABC Radio. APNA is supporting calls to allow nurses to prescribe medications for early medical abortion. The need for affordable and accessible early medical abortion services has been amplified during COVID-19 due to women suffering financial duress and increased rates of family violence. APNA President Karen Booth says this important service could be offered by sexual and reproductive health nurses, midwives and nurse practitioners. She says nurses are well placed to provide these medications to women in a timely and trusted manner. This would be particularly helpful for women in rural areas and for women from culturally and linguistically diverse communities. The change is being advocated by the Women's Sexual and Reproductive Health COVID-19 Coalition. The International Council of Nurses says more than 1,000 nurses have died worldwide due to COVID-19. The ICN branded the situation catastrophic and said governments were not doing enough to protect frontline healthcare workers during the pandemic. Brazil and Mexico were the two countries with the highest recorded deaths of nurses. ICN President Annette Kennedy said it was scandalous that nurses were undervalued, underpaid and treated as expendable. She urged governments to take immediate action to better protect health workers. Nurses sent in to help Melbourne's coronavirus-ravaged aged care facilities say they are gravely concerned for residents who have been stuck in virtual solitary confinement for months. Clinical nursing consultant Shane Durrance says he fears there will be a long tail of ongoing deaths in nursing homes due to the pandemic, unrelated to virus infections.
We need to understand that putting people in isolation has detrimental effects all of its own.
That audio from ABC's 7:30 program. A new nurse-led walk-in clinic has opened in the Canberra suburb of Dixon. The clinic is part of the new Dixon Community Health Centre redevelopment and will employ 16 extra nurses and 4 administrative staff. It's the 5th walk-in centre to open in Canberra, joining centres at Tuggerong, Western Creek, West Belconnen and Gungahlin. Walk-in centres provide treatment for minor injuries and illnesses to help relieve the pressure on Canberra's emergency departments. The clinical nurse manager at the new clinic, Anne Douglas, says its nurse practitioners are all educated at master's level and the advanced practice nurses have years of clinical experience. Meanwhile, in Melbourne, an enterprising nurse practitioner has started an in-home immunisation service. APNA member Nadine Hanare says the service is for people who may have delayed getting their vaccines during COVID-19. She says it is essential for the health of the community that people keep up to date with their vaccinations. She has an account with the Victorian Department of Health and Human Services and has access to all funded vaccines. Federal Health Minister Greg Hunt and Regional Health Minister Mark Coulton have praised the role of primary healthcare nurses in keeping Australians healthy during COVID-19. The pair were speaking at the launch of Nursing in the Community Week in September. Mr Hunt said Australia was well served by highly trained and skilled nurses working in general practices, correctional facilities, Aboriginal health services, the Australian Defence Force, schools and hospices. Both he and Minister Coulton acknowledged APNA's role in helping to build the capacity of the primary healthcare workforce through the federally funded Nursing in Primary Healthcare program. And finally, the team here at APNA is putting its best foot forward for better health during the Melbourne lockdown. So far, we've racked up more than 5 million steps in the first 2 weeks of our 10,000 steps daily challenge. That's the equivalent of walking to Darwin. This fine feat of fancy footwork is definitely keeping us on our toes.
From the outset of this pandemic, experts have been saying that a vaccine would be 12 to 18 months away. 9 months in, it sounds like we may be getting closer, with over 30 candidate vaccines now in clinical trials around the world. When the time comes to immunise the nation, primary healthcare nurses will play a pivotal and key role. So what are these vaccines? How do they work? Which are the front runners? APNA's Mitch Wall reports.
It's a race for the human race, finding a vaccine for COVID-19. So far, the Australian government has backed not one, but 2 potential winners, signing agreements with drug company AstraZeneca, who's developing the University of Oxford vaccine, and the University of Queensland, who's working with CSL to develop their own. Prime Minister Scott Morrison says the agreements, which total $1.7 billion, will deliver Australia more than 80 million doses.
It's a sovereign vaccine plan because this vaccine plan and the agreements that are supporting it is that it is giving us the capacity to not just produce the vaccine here in Australia, and that is the AstraZeneca vaccine, but also to develop and produce the University of Queensland vaccine.
The Australian government's scientific and technical advisory panel have been assessing a range of potential vaccines from around the world and have signed on to COVAX, the multi-country vaccine buying initiative. Professor Katie Flanagan, the head of infectious diseases and clinical professor at the University of Tasmania, says vaccine developers are approaching the challenge in various ways.
They use all the different platforms of vaccine design. So if I was just to go to the UQ and the Oxford one, the Oxford one is using a chimpanzee adenovirus. So basically it's a virus that is non-replicating, that carries the genes of the spike protein of the SARS-CoV-2 virus, gets that into the cells, gets it expressed in the cells, and then you start making an immune response to it. The UQ vaccine is based on the spike protein itself. So it's called a protein vaccine. And what they have done there is they have stabilized that spike protein by using a special thing called a molecular clamp. And what that's done is using a molecular method to hold the spike protein stable. And the reason for doing that is because what you want to do is induce antibodies against how that protein would appear when the virus infects you. If you just make the protein, it doesn't always hold itself in the correct form and it just collapses, and then you don't get antibodies to the correct bits and you don't get actual neutralization of infection.
It sounds like when we do get a COVID-19 vaccine here in Australia, there may be some substantial logistical issues that will need to be addressed. Chimp adeno vaccines, which the Oxford vaccine is, often need to be transported and stored in minus 70 degrees. On top of that, it sounds like any COVID vaccine will be a 2-jab schedule.
I suspect for a whole naive population in the world, we're probably going to need 2 doses to begin with. But the first dose will give a level of immunogenicity, and let's say you were exposed to the virus in the meantime, you would likely boost up some sort of protective response.
As it begins to get colder in the Northern Hemisphere and many countries are now experiencing their second wave, we're all hoping that a COVID-19 vaccine is available here soon. But we may need to wait a little longer.
And if you look at the phase 3 clinical trials websites where they've actually registered their trials, you can see that most of them are planning their trials to run through to the whole of next year and possibly even the year after that. But if we get some really good candidates showing some good protection, then I think there will be a rationale for getting interim approvals to bring it into different countries and vaccinating certain populations.
But we may have a vaccine already that can help slow the spread of COVID-19, with trials underway involving the BCG tuberculosis vaccine.
There's been a long body of evidence showing that live vaccines have immunological effects on your immune system that actually enhance your immunity. And for BCG vaccine, that's been shown to cause enhanced innate immunity and can therefore protect you against other invading infections, including viruses, including respiratory infections. And so what the theory is there is that giving a dose of BCG vaccine will actually provide some broad immunological stimulus to people and help protect them against SARS-CoV-2 if they actually encounter the virus. So nobody thinks it is the be-all and the end-all, but we know it's a vaccine that's licensed and that works, and so the idea is it might give some protection. Now, it's not licensed for that indication, and it may be that a specific vaccine will come along anyway very quickly, and we'll be able to use that. But it just is an idea that you can also boost the immune system using a different vaccine.
So as we look towards 2021 and wait with bated breath for a successful COVID-19 vaccine, who are the experts putting their money on?
I wouldn't even like to put my money down either on a time that this might happen or on a particular candidate.
Once a vaccine is available in Australia, we know that primary healthcare nurses will play a vital role in administering this vaccine to the public. In the next episode of Nursing Australia, we explore the logistics of how this will happen. For APNA members, there's an extended interview with Professor Katie Flanagan on COVID vaccines available. Click the link in the show notes or visit apna.asn.au to listen. We'll be back right after this.
Are you a new nurse? Are you unsure of where you want to take your career? Would you like to feel more confident in your practice? With COVID-19 freeing up your social calendar, now is the perfect time to put some TLC into your career. APNA will help you identify your nursing niche, map out a career and education plan, and get you started on core skills relevant to your career path. We'll help iron out your career and education worries with 3 useful resources, including our Foundations of Chronic Disease Management, a $200 online learning module, absolutely free. For only $25 a month, join as an APNA member and use the promo code SKILLUP. Offer ends 30th of September. For more information and to skill up, head to skillup.apna.asn.au.
The aged care sector has gained a lot of negative media attention lately, but we all know that in residential aged care there are many hard-working nurses trying their absolute best to care for their residents and to protect them. We're hearing that some facilities are spending upwards of $100,000 a month on PPE alone, having staff and all visitors don head-to-toe protection. But it sounds like there are some positives coming out of all of this in the aged care sector. Joining me to discuss this is aged care nurse and APNA board member Melissa Cromarty. Hi Melissa, great to talk to you today. Can you give me an idea of your COVID-19 experience and how it has affected you?
For me personally, it has made work fairly harrowing. From a working perspective, it's just added a whole nother layer of complexity to what we do on a day-to-day basis. Yeah, so it's been pretty tough, but it's also brought with it some rewards. I think you get to put policies and procedures in play that I guess have been there for some time that you just think, oh, they're there just for the in case, but then you're putting some things into play and refining and fine tuning, which has been a fairly positive experience as well.
So Melissa, what changes have you made in your facility due to COVID-19?
Yeah, so over and above your standard infection control protocols and policies that you have in play, like in any clinical environment, it's just been those additional layers. So I guess articulating the importance of, the COVID restrictions that are in place, so the PPE being worn by relatives when they're coming into the facility, why they need to register, talking through the legislation changes where people can't visit unless they've got evidence of having had flu vax. So it's been supporting, I guess, the community in general in view of why we're putting these changes into play and why it's so important. Every single resident, every single day has a COVID screen, not a test, but just a screen where there's a series of questions or observations that the nurse needs to make on every single resident, along with their temperature being recorded every single day. So it's like another job that's quite, well, it's additional. When you've got 150 residents and you're going to put in another process that has to be done for 150 people every single day, it just adds to the workload. It seems like there's been so much additional put on us. And in a true understanding of why we're doing it, but there's the extra work, but not necessarily the extra people to deliver the work.
How are the residents in your facility? How have you found the last few months?
It's been tough, but interestingly, we've been surveying our residents, and whilst not every resident has got the cognitive ability to respond to the survey, those that have been able to respond, we're getting a high percentage. Like there's only been two or three people that have said, they're not liking what we've done, or they want the doors to open, they want relatives back in, but everybody else has gone, nah, keep them out. we want to be safe, we feel secure, we feel informed.
Obviously aged care has been in the news. How's that been for you, Melissa, and the other nurses that you work with?
Yeah, that's been particularly difficult for me, to be true. It's been really hard where you feel like, I know myself, I'm putting in 15-hour days, and it gets, just lately, probably the last 6 to 8 weeks, it's really difficult to get up and go in and, put on your armour and have a brave smiley face, because you feel like whatever you're doing, you're just being vilified in the media. A lot of feedback from families, which has been positive, saying you're doing a really good job and, thank you for all that you've done. And I don't know, that's good. Yeah, so I guess it would just be good to be able to fix that negative perception, but also sell aged care nursing as the amazing industry or part of our nursing field that people should come into. It's not a place to come and retire to. It's it's very complex, and you need to be, really highly skilled. And I think that if more of our primary care nurses were, could have a positive look at what you actually do and the complexity of the role of an aged care primary care clinician, that we would see trained people choosing aged care as a career pathway, because it's so rewarding. So I'd like to see that.
What are the positive things to come out of the pandemic? What's gone right?
I think the early introduction of the policies and procedures and the zoning really instilled confidence not only in our residents but also in our staff. I feel that there's been a greater focus for me on communicating with my relatives of the residents I care for. So I feel that I've really built a much firmer and stronger relationship with their loved ones. And we've got an improved open dialogue, which has been really good in, negating any issues and ensuring that we're allaying any of their concerns. So I feel like that improved relationship actually impacts so positively on the resident, because they can see that unity with their loved ones. Like, they can see you're all working together to make sure that the care that they're receiving is how they want it, and they're getting everything they need. But there's also those personal tweaks that you're doing for each resident that the families are seeing as well.
Thanks so much for your time, Melissa. Great to catch up with you.
Thank you, Karen.
Nursing Australia, the podcast for Australian nurses working together towards a healthier Australia. Primary Times is APNA's biannual magazine for primary healthcare nurses. Stay up to date with the latest news and features about the emerging trends in primary health, the vital role played by nurses in patient-centred care, and health policy updates from APNA. Our next edition showcases nurses leading the way in their communities across Australia, plus insights from some of the nation's most respected health leaders. Primary Times is an APNA member-only publication. The next edition will be distributed in the first week of November.
It certainly has been a wild few months since the government announced measures to stem the spread of COVID-19. The pandemic containment response, whilst largely successful in most of the country, has uncovered a few shortfalls in the health system. These cracks started appearing when many patients stopped going to the doctor, scared that they would get sick in the waiting room, or assuming that clinics were closed. With less foot traffic, a significant number of health services began cutting staff and clinic hours. Hundreds of frontline primary healthcare nurses have borne the brunt of this. Incredibly, this is happening in the middle of a health crisis when you would think nurses are needed more than ever. APNA has quickly formalised a way to capture what was happening to nurses in primary healthcare, so their voice could influence the health policy that was responding rapidly to the ever-changing COVID-19 context. So what have nurses on the ground been saying? And what has APNA done to respond? APNA's policy manager, Shanthi Gardner, explains. Some of the following audio is from the ABC's AM program.
With our health system under increasing pressure, there's a push to allow nurses to treat patients with chronic health conditions over the phone or online. The federal government has authorised a number of healthcare professionals to start using telehealth services, but thousands of primary healthcare nurses have so far been excluded.
Now the push is on to include the 15,000 registered nurses working in GP clinics.
Those important maintenance of health issues, we don't want to see those slip and then let those patients go backwards, because what will happen then is they'll get sick and they'll end up in hospital.
We've got to make sure that all Australians can access healthcare when and where they need it in the most efficient way possible.
APNA has been surveying primary healthcare nurses since March about the impact of COVID-19 on them and their patients. APNA established PulseCheck as a regular way to check in with nurses on the ground in primary healthcare after lockdown restrictions started seeing unintended consequences for healthcare providers in the community. We reached out to nurses from all settings, from community health, mental health, aged care, general practice, corrections, schools, Aboriginal health, nurses working rurally and remotely, and those in metro areas. As the circumstances around COVID-19 continued to change, we pushed out these polls periodically to capture the impact on nurses. The first PulseCheck survey went out on the 30th of March and received 1,237 responses from primary healthcare nurses in 3 weeks. We heard that 73 nurses had their employment terminated as a direct result of COVID-19 and 29% had their hours reduced. However, 18% had had their hours increase, and one of the nurses who responded had found new employment as a result of the pandemic.
Our survey results also indicate a huge loss of clinical care, further limiting access for patients with chronic, complex conditions whose care is supported and coordinated by nurses. APNA is working very closely with the Department of Health on ways of increasing cash flow to general practices to support continued nurse activity.
That's APNA President Karen Booth in an article from Croaky News. With nurses locked out of telehealth policy and the small business of general practice feeling the downturn in patients coming through the doors, nurses were losing their jobs. At the outset of a global health crisis, the diminished employment of nurses was perverse, and APNA swung into action. Feeding PulseCheck data with a direct line to the Department of Health Principal Medical Advisor, Professor Michael Kidd, and getting the message out across media, APNA President Karen Booth called for nurses to be given greater access to telehealth so people with chronic disease could continue to receive care at home during the COVID-19 crisis and keep pressure off hospitals. Here is Karen Booth again.
Right now, Australia has to adapt to the greatest health challenge of our time. We certainly can't afford to sideline our largest health workforce outside the hospital system, and that's the 82,000 nurses working in primary health care. We have to remove the barriers so nurses can provide remote care for vulnerable patients who will increasingly self-isolate at home to avoid COVID-19 infection. And we need to support those patients while they're at home to prevent unnecessary hospitalisations. This will free up time for hard-pressed doctors and resources for hospitals already stretched by COVID-19. COVID-19 is a game changer. It means we have to empower everyone in the health workforce to play their part in keeping Australia healthy and keeping the health system going. And telehealth is a no-brainer. It lets us keep caring for people while reducing their risk of exposure to the virus.
On the 20th of April, after heavy lobbying from APNA with support from the Australian Healthcare and Hospitals Association, Consumers Health Forum and the Australian Institute of Digital Health, the government expanded access to telehealth to include nurses. The telehealth items would allow nurses and Aboriginal health practitioners to safely reach into the homes of more susceptible patients and provide support to keep up their managed care treatments. This was a win for patients. But despite this, nurses still reported through social media, APNA's nurse support line and directly in conversations with staff that they were losing hours and in some cases their jobs. The second PulseCheck survey on the 20th of April of 878 nurses showed that 43 had lost their jobs in primary healthcare and 31% had had their hours reduced. Putting the data to work, APNA continued to feed this information to the department's Principal Medical Advisor, Michael Kidd, as well as providing insights to government officials through weekly teleconferences. In May, APNA joined an Australian first national communication collaboration of 15 peak bodies, industry and healthcare organisations which came together to stress the importance of Australians continuing to access healthcare during the pandemic to ensure optimal long-term health. Together, the member organisations represent the broad healthcare ecosystem, and activities across the coalition to date at the end of August have generated an estimated media reach of 258 million hits and around 1 million via social media. Educating nurse employers about the breadth of the nurse scope is an ongoing role of APNA, and in June we collaborated with the Royal Australian College of General Practitioners, the Australian College of Rural and Remote Medicine and the Australian Association of Practice Management on a guide to making the most of the nurse role during COVID-19, a resource titled Why General Practice Needs Nurses More Than Ever. This resource was disseminated through the project partners, available on APNA's website, and there is a link in the show notes of this episode. Here is Karen Booth.
Many nurses felt disposable. These long-term employees, really dedicated to their role, were just cut. And a lot of nurses who called our helpline said they weren't going to do primary care anymore. There is a level of disappointment and disillusionment among general practice nurses right now, who've suddenly found that they are disposable. What I've heard from our members is absolutely heartbreaking. These nurses love what they do and they give their all every day, but disposable is what they feel. But skilled nurses may not be willing to return to general practice, even after the numbers pick up due to the uncertainty around funding.
The most recent PulseCheck survey of 671 nurses in August shows the trend continuing. Many general practice nurses are still doing fewer hours than before COVID-19, despite MBS funding for telehealth. 15% are still working reduced hours and 1.2% had lost their jobs, though 11.5% had increased their hours. The situation for nurses is slightly worse in Victoria and New South Wales, harder hit by the second wave of COVID-19 outbreak, where 18% of general practice nurses said they had suffered a fall in paid hours. APNA sees COVID-19 as a circuit breaker to achieve the funding reform primary healthcare has needed for some years. It shows the weakness of the current system in addressing the big picture of complex care management, which has fostered a reliance in some quarters on episodic MBS funding. So how do we fix this? The patient load is not going away. Much work has been done to look at population needs and planning to predict the number and type of services needed for the community. The COVID-19 pandemic is opening the door to a discussion about funding. Paying for episodic care dependent on face-to-face, come to the doctor when you are sick or in crisis visits is not a sustainable model for complex care. If there was widespread use of adequately funded bundle payments for people with chronic complex health issues, allowing flexible use of health team members, the workload for chronic care would be predictable. Funding income would be predictable with resources and staff allocated in a predictable fashion, not the boom and bust of the early weeks of the pandemic. Nurses could get on with doing what they do best as part of a multidisciplinary care team.
As this podcast goes to air, 18% of nurses surveyed in Victoria and New South Wales report their hours have been cut during COVID-19. And worryingly, another 19% have said their employers have flagged further cuts and possible job losses. With 17% of primary healthcare nurses being casual and 50% part-time as reported in the most recent APNA workforce survey, this has made some of them easy targets to cut costs. Health services need to think more creatively about patient care. That's a given. A different funding model would probably deliver better job security for primary healthcare nurses. Let's face it, these are skilled professionals. We can't afford to lose them from the workforce. APNA will keep fighting that fight. Listeners can read quotes from nurse respondents in the show notes of this episode. View these in your podcast app or visit apna.asn.au. We'll be right back.
Who has the time to wade through every piece of healthcare news? Primary healthcare nurses certainly don't. Fear not. APNA's Weekly Connect e-newsletter condenses key industry news into digestible content while serving up a feast of useful resources. Stay in the know and save time. Subscribe for free at www.apna.asn.au.
This podcast is brought to you by APNA, the Australian Primary Healthcare Nurses Association, and is only made possible by our members. Join today. Google APNA membership.
Self-care is vital for nurses. At all times, and especially during these times. As nurses, we can't care for others unless we first of all care for ourselves. So how do we respond to the pandemic when it's largely out of our control? Well, if we respond with hatred, fear, or ignorance, it increases the suffering. But if we respond with generosity, clarity, steadiness, and love, it's a whole different ballgame. In this moment, we need to sit quietly, take a deep breath, and acknowledge all the feelings, the fears, the apprehensions, the uncertainty, the helplessness, and hold all these feelings with a compassionate heart. It helps to pause, take a deep breath. Taking us through today's guided meditation is APNA's own Casey Mannix. Casey has led the organisation in lunchtime meditations and has a real passion for mindfulness and self-care.
Thanks, Karen. Hello, everyone. Let yourself sit in a way that's comfortable and stable. Let your eyes close gently. Take a deep breath in. Hold it for a second and breathe out. And another breath in. Hold and breathe out. And one last deep breath in. Hold and breathe out. Bring your attention to the here and now. Feel into your body. Notice what you find with a loving awareness. There might be areas of tension, the responses of fight, flight, or freeze, the accumulation of the stress we've all been under. As you pay attention to your body and to all the contractions, hot, cold tensions and pains, let them be held in a loving awareness, without resistance, without judgment. As you notice what's present and make space for loving awareness, things can intensify, move, change, and soften. Now bring in compassion and say to your body, "Thank you for trying to protect me." All the contractions and the tensions are ways your body protects you. You can say to your body, "Thank you for this. I'm okay right now." You can release and relax. Thank you. Now bring your attention to the area of your heart and notice what feelings are present. There might be sadness, anxiety, or fear. There might also be tenderness, love, and courage. Tune in. Let yourself acknowledge what you feel in your heart, what's being carried as we go through this crisis together. Acknowledge the feelings that are present. Allow them to open in the space of your loving awareness, without judgment, without resistance. Just let them be. Let them open as they need to. Give them the space. And again, bring in the quality of compassion, that tenderness towards all these feelings you've been carrying. As you acknowledge them, you can say, "Thank you. Thank you for trying to protect and care for me." And as you acknowledge them with gratitude, you can also say, "I'm okay right now. Thank you." And make space for these feelings to open, soften, and dissipate in whatever way they will. Now go to your mind, all the plans, the thoughts, the worries, all of it. And again, acknowledge what's present. Notice what happens as you bring this kind attention to these states of mind, how they can open, intensify, and expand. And like clouds, begin to soften and dissipate the vastness of your loving awareness. Thank them. Say, "Thank you for trying to protect me." To the overactive, over-worried, overtired, overstimulated mind, thank you. You've done your job. I'm okay right now. Feel how you are okay just where you are. Present, gracious. Bring in the compassion and let the mind settle. Now bring your awareness back to your feet. Begin to trust that you can be present for all that arises, all the tensions, the difficult emotions, and the stories in the mind, and not be so caught up in them. You can be the wise one, the loving witness with the steadiness and courage. This is who you really are. This is the time to steady yourself. If everyone panicked, all would be lost. But if even one person remains steady and calm, it is enough. It leads the way for everyone to survive in these trying times. And you know who that person is, don't you? In your family, in your community, in this world, you have this capacity to quiet yourself and the mind and tend to your heart. Gives you grounding and presence. It reminds you of the courage and dignity you have to move through this. You can be a beacon, a medicine of the heart for all you touch. Now, when you are ready, open your eyes gently and know you are ready to return to your day.
Thank you so much for that, Casey. It's amazing what stillness and awareness can do for us. Well, everyone, that brings us to the end of this episode. I really hope you've enjoyed it, you found it useful, you found it educational, and I really hope that you're going to be back for the next episode. Don't forget to subscribe or follow to ensure that you don't miss the next episode. I'm Karen Cook. See you next time. Stay safe till then.
Nursing Australia, the podcast for Australian nurses working together towards a healthier Australia. For more information, please visit us at www.apna.asn.au. Thanks for listening to Nursing Australia.